In 1914, a group of wealthy American women started a revolution. They didn't want the curse of Eve, they wanted a painless birth. Their solution was Twilight Sleep. It promised you would wake up with a baby in your arms and absolutely zero memory of the labor. But as the saying goes, just because you don't remember it doesn't mean it didn't happen. The treatment was a cocktail of two powerful drugs: morphine, to dull the pain; scopolamine, to erase the memory. Scopolamine is an amnesiac. It didn't actually stop the pain of labor, it just made the brain forget to record it. Because of this, the woman was still physically experiencing every contraction, but her mind was in a drug-induced fog. This is where it gets dark. Because scopolamine removes inhibitions, women in twilight sleep would often scream, thrash about, and even strike out at doctors. To manage this, hospitals put women in labor cribs, beds with high padded sides, and sometimes even strapped them down in straitjackets or tied their hands to the bedposts. They were left in dark, soundproof rooms, hallucinating and fighting through labor in a state of total sensory deprivation. The movement hit a wall in 1915 when one of its biggest champions, Mrs. Frances Carmody, died during a twilight sleep birth. The drugs also had a terrifying effect on the babies. They often came out blue, lethargic, and struggling to breathe because the morphine had crossed the placenta. Doctors had to use aggressive methods to revive these drugged infants, leading to long-term health complications that were ignored for years. Twilight sleep stayed popular in the US until the 1960s, when investigative journalists finally exposed the cages and the trauma mothers were enduring. It serves as a haunting reminder that in medicine, painless doesn't always mean safe. If you found this dive into medical history fascinating, hit that like button and subscribe to the channel for more. And tell me in the comments, would you choose to forget a painful experience if a drug could do it for you?